Shana, we can go ahead and start. Go ahead.
Perfect. Ram Kabir, everyone. Thank you for coming. Today we're going to be having a grief and loss panel, and today we have three very special panelists who took the time to speak to us today. So we're very excited for them to get their professional knowledge, and they're professionals in this industry. So we're going to go ahead and start with the panelists and let them introduce themselves.
Thank you, Shana, for getting us started. I appreciate it. Ram Kabir to everybody. We're really excited, really passionate about this topic, and we're really thankful for the Bhakta Samaj as well as the Bhakta Youth Mental Health Group for coordinating and putting together this very important workshop, especially coming out of COVID-19, as well as at a time where many people have experienced various griefs and loss. So we are thankful to be here. We're thankful to each of you for joining us as we go into this exploratory topic. A little bit of background about each of the panelists. I'll get us started. I completed a PhD in psychology last year. My passion is in South Asian mental health. My research is focused on clinical interventions as well as treatment efficacy for South Asians. And so this was when Shana and Aarti asked us to be a part of this, it was almost a natural fit. So I was very thankful to be a part of it. Outside of my research, I'm currently a professor at the Kansas College of Osteopathic Medicine, teaching preventative medicine and working in consulting. So that's a little bit about me, and I will kick it over to Hema to introduce herself.
Again, and I'm good to everyone. Thank you so much for having us present to you today and taking the time to join us. Brief background on me. My name is Hema Bhakta. I'm from San Antonio, Texas. I have my master's in counseling, and I've been a therapist for just shy of 20 years. I did the math the other day and I was like, oh God. So just shy of 20 years of being a therapist. Early on in my career, I did a lot of work on what's known as the SPMI population, severe and persistent mentally ill, doing outreach and community mental health. But for the last 10 years, I've been working with the military, specifically the Air Force, and I provide therapy for our service members and their dependents. In addition to that, I'm also certified in what's known as CISM, so critical incident stress management. That allows me to work with different corporations around the United States on dealing with different stressors that happen in the workplace, what's known as critical incidents. So anywhere from loss of an employee to even unemployment when business is shut down, the grief cycle that comes up from that. And then South Asian specific, about 10 years ago, I also co-founded an organization out in San Antonio. It's a 501c3 nonprofit called Avaz that works specifically on domestic violence in the South Asian community. We do peer support and peer counseling for individuals affected by violence. We also provide education to the South Asian community on what family violence and domestic violence looks like. And we also do linkage to resources locally and educate them about different South Asian cultural barriers that may get in the way to treatment. Thank you.
And then my name is Dr. Sagar. I'm a clinical neuropsychologist. I did all of my psychology training, and then I did a 2-year fellowship in neuropsychology. My main area of focus right now is military and veterans. And I do a lot of traumatic brain injury, a lot of geroneuropsychology, where I am seeing individuals for dementia care, grief and counseling when individuals are passing away with our veteran population. In terms of South Asian mental health, I've recently, in the past couple of years, have gotten really invested in diversity, and recently published a paper on South Asian mental health with COVID, and I'm continuing to publish work on diversity or DEI research with BIPOC individuals to promote BIPOCs in the field of neuropsychology and psychology so that our voices can be heard. So my primary place where I work is the Salem VA in Roanoke, Virginia, and I am faculty at Wake Forest School of Medicine.
Excellent. Thank you, Hema. Thank you, Sagar. I do want to share, it's been a pleasure collaborating with both of you and your amazing wisdom and knowledge on this topic. And we're really thankful to have you both with us to share with our community. Before we get started, we do want to share that what we will be going over today can be difficult for many. And so we would like to acknowledge as presenters that the content we may be sharing may be triggering, and it may remind you of times that are difficult to process. We do encourage you to take care of your well-being. At any point, you're welcome to depart from the Zoom meeting. And at the end of the meeting, we will be providing resources should you need immediate care after our discussion today. So to get us started, I think it's important before we can even begin talking about mental health and grief and loss, it's important to understand how South Asian mental health and the South Asian context create such a different dynamic as we begin to dive into some of the topics that we're going to be talking about. First and foremost, we understand and we know that there is a significant shortage of research on mental health of South Asians. And we also understand that treatments and modalities used in the Western world or here in the United States are not always effective or clinically relevant for individuals of South Asian descent. So that's where my colleagues like Hema and Sag and I are working hard to help bridge this research gap to make sure that our community has the proper tools and resources and clinicians to be able to support them. As we get started, I want to bring up the topic of disenfranchised grief, primarily because you will hear us use the word grief and loss quite a bit throughout today's session. But I really want to highlight what disenfranchised grief is. And disenfranchised grief is an experience where it is not validated or supported by the social world of the mourner. And I think in the South Asian community, due to the stigma and due to the taboo related to mental health and due to processing of emotions, many people might and can be experiencing disenfranchised grief. And it's acknowledged that there are many people in our South Asian community who do grieve in silence without support or affirmation from their family, friends, or community. And so we do want to share that while we will be talking about various types of coping strategies, tools, and techniques, that this may be relevant to you, and we acknowledge that. Lastly is when we're talking about grief in today's conversation, we want to share as a panel that your experiences are real, valid, and true, despite if your way of grieving or what you are experiencing doesn't necessarily fit with what people around you should deem it to look like. So to get us started, there are a variety of types of loss, and I want to highlight that there is an important aspect to this. When we talk about loss, many people think that there's only one type of loss, and that's loss through a death. However, it's important when we're thinking about grief and loss that there are a variety of different types of loss which can trigger the emotional reaction of grief. And so this could be the loss of a close friend, of course, death, which we've talked about, the serious illness, a terminal diagnosis for somebody who we are close to, a relationship breakup, a divorce, the death of a family member. But there are some subtle or less commonly known avenues that can initiate grief. And as we think about those, that's leaving home. It's becoming an empty nester. If your children have gone away to college recently, you may be experiencing loss. While it's not a traditional definition of loss, the experiences and the emotions related to it can be a type of grief. The death of a pet, the change of a job, being laid off in COVID or after COVID, or for whatever reason, graduation from a school, leaving behind our friends, community, colleagues, and peers, loss of physical ability, maybe after some kind of accident, and loss of financial security. So what we want to highlight with this as we start talking about grief and loss today in the South Asian community is that we are not only talking about death, we are talking about a variety of different types of loss, whether they are sudden or whether they're predictable. What is grief? We get this question all the time, and it's a very, very complicated answer. And the true answer is that grief is a natural reaction to loss. It's both universal, meaning that it is something experienced by individuals across across the humankind, if you will, but it's also very, very personal. And that's why today when Hema and Sa talk a little bit about coping mechanisms, it's important to find what's right for you, because there is no way or right way to grieve that works for everybody. And so we do want to highlight that. It's also important to acknowledge that we grieve places and moments, not just the person. And so as we're thinking about South Asian grief and loss, it's important to acknowledge that there are places which you can grieve, there are moments which you can grieve, and there are people. I'm not going to go into this entire list with you because I would likely bore all of you to death. And I know that not everyone is here to learn the ins and outs of the types of grief, but I do believe that the organizers will be sending out this recording as well as our slides to help you learn more. But there are a few that I want to highlight, especially in the South Asian community. So anticipatory grief is important, especially with the aging population. In the South Asian community, we often hear of individuals caring for the elderly, parents, and whatnot. And it's possible to begin experiencing grief long before the loss. And I think that it's important to acknowledge that integrating tools and techniques into your daily life will be critical and will be paramount as you work through this anticipatory grief. And we will be diving into that. Delayed grief. We're going to be talking about, in the South Asian community, we have prathnas, we have artis, we have various rituals which take place immediately following a loss. This can result in delayed grief. And what this means is that our reactions, our emotions are postponed until a later time due to the focus on completing what needs to be done from a cultural and ritualistic perspective. But we also acknowledge that for the younger generation, you might not find meaning in these rituals, and they may be causing you more grief if you're unable to process your emotions. And I know Hema is going to dive into that and provide some really good information today on how to balance rituals and the various things that we do as an Indian community with respect for our culture, but respect for yourself as well. We've talked about disenfranchised grief. I think, you know, I've experienced personal loss, multiple over the last few years. And sometimes when we don't experience grief the way society thinks we should express it, or the way that they think we should be grieving, not everybody cries when they're grieving. Not everybody is angry when they're grieving. People prefer to share memories versus sit in silence. There's just a variety. And so we'll talk about disenfranchised grief today. We're going to talk about cumulative grief. That's multiple losses experienced back to back without the ability to give ourselves the time to properly grieve. And lastly, the one I want to highlight is absent grief. Especially in the South Asian community, it can be very possible that someone does not acknowledge the loss and can show no signs of grief. And this could be due to complete shock, denial, for whatever reason, they may not be expressing that grief. Off to the right side, you have the Kubler-Ross grief model. And I think what we really hope is that you walk away from today's presentation knowing that there are stages of grief, but I want everyone to think of these more as descriptors of grief. I often hear in practice that I'm on stage number 2 of the grief cycle. And I said, no, I think the description of stage number 2 fits what you're feeling right now. I also want to point out that the grief cycle is nonlinear and can occur very probable, like the right side on the diagram there. And so, you know, there are various things, and you are never stuck in a stage. You know, I think people will share, I've been angry for the longest time and I can't get over this anger. I'm stuck in the anger stage. And the truth is, you're not stuck in that stage, but you are in a descriptor or in an area where you need to process your emotions and become in sync and find clarity that helps you resolve any loose ends and move forward in a healthy way, which we're going to talk about today. What are some ways, that you might find yourself regressing or moving backwards or crisscrossing? Anniversaries of a loss are difficult, whether it's death or otherwise. The anniversary every August for a lot of parents when their children moved to college and they became empty nesters, the loss of a spouse or partner, the anniversary of losing a job. These anniversaries are external triggers which can help, which actually not help rather, but will facilitate movement within the stages or within the descriptors. And so our goal with everybody today is please do not think of the stages of grief as a ladder. These are not steps that will help you climb out of what you are feeling. These are mere buckets that help explain what you are feeling. So lastly, before I turn it over to my colleagues for more of the tips, tricks, and tools, is ritualistic grieving. And as we take what we've just shared and put it into the South Asian context, South Asians in general, and I can relate and I can identify, have often shared that after a prarthana or after an arti or after the cremation, we should move on and life goes on. Those are the three words which I know my fellow panelists and I hope you walk away from today knowing that life does not go on. And Hema's going to dive into things that you should not say to people who are grieving later in this presentation. And that's exactly it. While your life in your respective reality may move forward, not everybody's life goes on. And so off to this bottom right, you'll see that there is a trajectory diagram with time on the bottom and our strength of emotion on the vertical axis. And so you'll see that as we are closer to the loss, our strength of emotion can be more variant or can be more positive or more negative in difference. But as time goes on, that emotion never leaves. It never becomes a flat line. And while there can be more space between our polarizing emotions because we are utilizing healthy coping skills, it's never going back to the very bottom. And so I think it's important to realize that while Indians might have expectations for how and when and are you grieving, that not everyone will fit this mold, and it's important that we support each other as a community in our respective ways of grieving. And then lastly, before I turn it over, is allowing ourselves the opportunity to grow with grief. I think that each day can bring new awareness. It might not bring new clarity. I do want to differentiate that, but each day can bring new awareness. And, Hema and Dr. Sagar Lad will be talking in a little bit about various things that you can do to help bring awareness. But I hope that everyone comes out of today's presentation knowing that there is no end result, that in 12 weeks, life returns back to normal and that everyone forgets everything that happened. And, as a matter of fact, I can speak from personal experience that forgetting what happened, in my mind, is one of the most disenfranchising things we can do to the individual or to what we experienced, and also to the community who we support. So life does not go on after loss. That's my key takeaway. I will turn it over now to Dr. Ladd, who will go over some of the more symptomology aspects of grief and loss.
Thank you. So when thinking about just grief and loss within the South Asian culture, we have to first think about reactions to and feelings about loss. And I tried to summarize from the limited literature that we have on South Asian grief. So this may include psychological and cognitive symptoms, and which may be related to emotional reactions, such as questioning the loss specifically in the manner at which the loss could have occurred, or questioning religion and idols in the context of what did they do, or why is our karma this way. This can also lead to like destiny blaming. Examples include, they had so much to live for, or, their life was just getting better now and they're living now. So much of these types of reactions can lead to hopelessness and depression. And as the literature says, South Asians experience hopelessness and depression in much different ways than our American colleagues, or even different other types of cultures. So hopelessness can look like, well, life has no meaning. It can also mean pulling away from things they loved, or feelings of a lack of closure from past conflicts. So such as conflicts with, uncles or aunts, or even neighbors, or other things that are happening that could be immigration related, or, support related. And this often, one of the biggest concerns is that there's an inability with this depression and hopelessness to be able to complete rituals, or rituals interfering with just the organic grief process. So physical symptoms can look like difficulties with daily functioning, such as one's sleep patterns, one's ability to engage with activities that they loved, or even engaging with day-to-day activities like paying bills, or cleaning up the household, or even cooking. And this could lead to a lack of appetite. And often this goes with poor memory, and we often don't question it, but forgetting events or forgetting important things throughout the lifespan. And then there's often an inability to concentrate, and possibly things like neurocognitive changes that affect reasoning, their ability to attend to something, and remember memories, and complete actions. So then what I want to talk about is just the impact of loss. And when we're thinking about designated roles and responsibilities, I really want to think about the context of immigration related concerns. And this can be a familial immigration related concerns with, am I able to bring family members over to able to grieve, right? Or am I able to go back to my own country to be able to complete tasks and complete ceremonies? This not only affects the ceremony per se, but it can affect the partner or the children, because what if the individual is on a visa? How does that work with loss? Including just shifts in roles and responsibility. There's also prejudicial experiences. So, what we want to think about is, during 9/11, there was just a completely different loss, or how we as South Asians experience loss of what happened in 9/11, or what is happening with COVID-19, right? Our ceremonies are different. We don't do the same things as our American or different other cultural aspects of it. And this could lead to prejudices from the environment, from our neighborhood, and just being able to take on the roles and responsibilities within the family context that can come up, when if a male counterpart passes away and their responsibilities, and when a female counterpart passes away and their responsibilities that the family has to take over for. There's also shifts in kingships. And what I mean by kingships is, South Asian families are interconnected. We're not just connected by blood, but we're connected by other individuals like neighbors or non-blood related uncles and aunties who are a part of our family now, right? And that can become a constraint on family memories. One person interpreted memories differently from another person, or how one person is keeping relations with another individuals, and how I'm supposed to keep up with those kingships. And then what we really want to talk about after this is just beliefs on loss in general. And I wrote the Western versus Eastern conceptualizations important because, I'm a first generation American. I don't know all of the rituals and ceremonies that my parents and my grandparents know. And if all of a sudden, or if my parents were to pass away, what would I do? I know what my Western colleagues do, but I don't know what I would do to keep up with my own religious Eastern conceptualizations. And that plays into like religious versus spiritual views. Would my parents or would my great grandparents or grandparents want a more religious ceremony when I'm more spiritual? Or what does loss look like for me spiritually or religiously, because I've learned religion in a completely different manner? And then we also want to talk about financial and legal aspects. One of the biggest things is that often we have to think about whether we're living in a patriarchal family, a matriarchal family, and who's controlling financial and legal aspects. Often kids aren't preview of parents and grandparents' financial and legal status? And what do we do post-loss to be able to talk about that? Talking about, or while someone's going through a chronic illness, on what are we going to do with the living will? What are we going to do with the DNR? What are we going to do if something were to happen? And then I think the biggest beliefs on loss is just death rights in general. What is the right of an individual? And I bring this up specifically because I've ran into several situations in my own private work with South Asians committing suicide, and how that would be different on what death rights look like, or as well as what families would want with them, and me being able to provide a more clinical or psychological understanding of that. Next, I wanted to talk about specific gaps in services. So I feel like there needs to be more cultural sensitivity in resources that are offered for individuals who are grieving and who have lost someone. When I'm at the VA, I can be on the geriatric unit, and if there's a loss, or if there was about to be a loss, I can bring in a chaplain or a pastor right away, because we live in a VA Christian or Catholic kind of system. The pastor's there, the chaplain's there with a moment within our fingers. We don't have that at our general hospitals or our major medical systems. There aren't enough social workers that are South Asians. There are not enough clinicians who are South Asians who are working at these hospitals. And doctors or physicians don't necessarily are educated to be able to provide, culturally specific care for their patients who are about to have grief or loss, or are undergoing grief or loss. And I also say there's a lack of services from culturally specific organizations. And I say that specifically from our temples, from our samajas, our associations. We collaborate together, but are there resources, for example, for myself, to be able to go out and be able to carry through ceremonies? And then I think the biggest kind of cultural sensitivity resource is the lack of advocates or brokers to help South Asians address other aspects of grief and loss, such as bills, immigration, ceremony, legal, funeral homes, right? During COVID-19, there was a disconnect on how many individuals can go to a funeral home or what we can do. And then next, what I wanted to talk about, and I think I've lent a little bit of this, is just a lack of cultural humility and cultural competence on grief and loss. As healthcare providers, we're always here to save our patients, and often we're not trained specifically to South Asian loss and what it means when an individual is transitioning from death to the next life. We also don't have evidence-based treatments for South Asians. Sue and Sue once said that the effectiveness of an intervention is enhanced when it's consistent with life experiences and cultural values of the client. And when we don't have evidence-based treatments, or we don't have enough clinicians who are South Asian doing these treatments, there's a disconnect with our own population, as well as the individuals who can provide that type of care. And lastly, I think there's just a lack of understanding of kingship within the South Asian culture. As a Western kind of view, you move the body as soon as they pass away, and we move into the funeral home, and then we move into the burial. It's not like that in South Asians. We have to make sure that our entire families are there to be able to provide the support and provide the resources for the ceremonies to occur. So I think kingship is a big thing that we're not really talking about with South Asian care.
Thank you so much for that. And I think you bring up a really good point, Sagar, as well, on just how there is a bit of a disconnect on generations, right? So whereas the older generation, I was just chatting with my niece about this earlier today too, the older generation, even older than my generation, they tend to really see grief as task-oriented. Like, these are all the things we have to do to mourn a loss, right? Whereas more on the Western side, those of us that grew up in America, we tend to more see grief as a process, right? Like, we're going to have those waves of emotions. We're going to have the anniversaries, things that come up. And that in of itself can be quite a disconnect, because oftentimes rather than showing each other grace and recognizing that we grieve different, we tend to judge. So kind of being mindful about that too as we move forward. I kind of want to pivot now the conversation a little bit to just ways to cope, right? Now that we know what grief is, how it looks like, both for different generations, the older generation, it's very common for them to have a different perspective, whether it's because of religion or their own upbringing, and when it comes to with death. I remember going to my parents' place and then like, 2 days after an auntie passes away, like, hey, delete her number from my phone. I don't need it anymore. And me over here, like still holding on to everyone's number in my phone because I like seeing their name. So kind of learning that disconnect as well. But when it comes to coping, as we've talked about, there's different ways people will cope. Some individuals will turn to tradition and rituals, and that's okay. Others won't, and that's okay too. So really being more forgiveful and showing grace on identifying what's helping people and what's not. So what I really want to focus on is healthy and unhealthy techniques of the coping. On the slides right there, you'll see like, unhealthy is anything that's chasing the numbness or avoidance or distractions from the feelings that grief tends to bring up. So, kind of asking yourself, like, what is this really healthy, right? The signs of these are excessive drinking, excessive gambling, excessive use of recreational drugs, going on benders, so to speak, right? But also excessive distractions, whether it's, I'm just going to go out all the time and socialize, so I don't have to sit with these feelings. It might help for a little bit, but in the long run, you'll notice that these are going to be more on the unhealthy side. Healthier outlets, believe it or not, structure helps us. Having a routine helps us because it's a known and it's something that's controllable in these uncontrollable situations. So keeping an eye on what you're eating and making sure that you're, nourishing yourself, not just by staying hydrated, but also eating right. Going on, walks or getting some form of physical activity to help with the fatigue in your body, because a lot of times how grief is described by my clients is that they are, and even in my personal life, the way I've experienced, it's like mentally you're so exhausted, but physically you're not, right? And when we're not physically exhausted to correlate with the mental, that's going to start getting in the way of our sleep. It's going to start getting in the way of our decision-making. So being more mindful of that, reaching out to family and friends and using that as a way to collectively grieve together. I think all too often, especially in our South Asian culture, grief is seen as something you do alone. We do all the rituals together, but then after that, you figure it out on your own, right? The loneliest time is after all the pratmas are done. The loneliest time is after all the services are done, because people, are no longer there and we're sitting there with our thoughts. So being more mindful of, using the opportunity to create new stories and share memories together. And as you're looking at the ways that you're coping, and we're going to talk a little bit more about techniques too, but as you're looking at it, I really want you to kind of think to yourself, like, is this helping with my feelings and my pain? Or is this numbing my feelings and my pain? And I want you to focus on chasing the things that are helping, and the things that are numbing and distracting you from the pain and from the loss. Show yourself some grace. I don't want you to spend too much time focusing on the times where you strayed and did something unhealthy. Instead, like, how do we get back on course into something healthier, right? Okay. Next, I want to talk about triggers. And I know Sajin touched on this a little bit earlier today. So we have different types of triggers. Some are referred to as internal triggers and others are external. Internal triggers are things that are going to go on inside you, right? Whether it's a thought that pops up, a memory that pops up, maybe you get the same knot in your stomach that you had when you experienced this loss. So different emotions that you feel are going to be internal triggers that kind of dive us into this grief cycle that we talked about. But then there's also external triggers, and we don't have as much control of those. It might be birthdays or anniversaries that are coming up. It might be a person that you look at and from the distance, they look just like the person that you lost, and all of a sudden their loss is front and center on your mind, right? Even though you were just off to work or whatnot. It can be bumping into people. It can be a scene in a movie, anything that's going on externally, including our sensories as well, right? So like seeing a car, that's the same kind of car she had. Those are all external triggers that can kind of cause these emotions to come up. And then that's where our coping techniques come in. What are some healthy ways that we can manage this added anxiety that comes over? And as we're talking about grief, obviously, while I'm talking right now, my main focus is on individuals that we lose, so the deceased. But keep in mind, collectively, globally, right now, we are going through a whole layer of grief just due to COVID. not just because of the people that we lost to COVID, but the time we lost to COVID, the memories we lost to COVID, and collectively sharing that grief so that it's compounding with other things that are going on. There's been a political divide. There has been tons of increase of hate crimes against Asians. So all of these things are compounding onto us and adding to our layers of grief so that a loss may be more challenging to handle than we normally would feel. So, again, be kind of mindful of that. So on coping techniques, I have the breathing exercises, the diaphragmatic breathing, many of you might be familiar with. It's, breathing like what we call belly breathing, not chest breathing, in from the nose, out from the mouth. There's also box breathing where it's like 4 counts in. So it's like you make a little box, but you're going to inhale for 4 counts, hold for 4 counts, exhale for 4 counts, hold for 4 counts, and then the cycle continues. There's we don't have the time today, but there's tons of biological stuff that's going on, and that's why breathing can really help. When I work with my service members, I always tell them, no matter what the situation is, you will always have control of your breath, so just pause and focus on that. Then we also want to pair it with some grounding exercises. Usually when we're feeling anxious or we are triggered, our senses kind of get hijacked in that moment. So we may physically be present in this room, but emotionally, our senses are, dealing with that memory. Right. So part of grounding is bringing your sensories back to the present physical state that you're in. It could be a mantra that you have for yourself, like this feeling's not going to last forever. This feeling's not going to last forever. There can also be other grounding techniques. Some popular ones out there are like the 5, 4, 3, 2, 1 method, where, this is more helpful when you're meditating or really focusing on being more grounded. I wouldn't necessarily recommend that method when you're in the middle of having some anxiety or in the middle of being triggered. But, simple things like, I'm going to look around and find everything that's blue in this room. I'm going to, sit here and try thinking of I'm going to age myself, try thinking of every like Bon Jovi song that I know. Little things like that can help you kind of get back into that present moment and move away from that hijacked emotion that we have. And then last but not least is the self-care outlet. So being mindful of, who can you reach out to? Not just who, but how, right? Luckily, because of today's day and age of technology, maybe you're going to be doing a Zoom call or FaceTiming them, but being mindful of who helps you socially doesn't necessarily mean who do you love, because sometimes even people we love don't necessarily help us when we're stressed out or when we're grieving. So be mindful of who you can turn to socially. Also be mindful of what helps you physically, right? Are you the gym rat that's going to go to the gym and get a workout? Well, what happens if grief really hits you in the middle of the night and you can't get to the So having maybe like Fit On or 7 or different apps on your phone that can kind of help with that. So or a favorite video on YouTube so you can work on that, right? And then I know Sag focused a little bit on the spiritual and religious outlets. Keep in mind, religion is a part of spirituality, but spirituality is so much more than that. So we may have some individuals that turn to religion as a way of self-care, and Pratna helps them. Doing these rituals helps them. And if that's not your thing, that's okay, but find what helps you spiritually. For me, I'm big on gratitude. I really, even on the crappiest of days, I try to find at least 3 things that I'm grateful for, right? And then last but not least is having a creative outlet, whether it's a favorite TV show, a playlist that you like listening to, journaling, a book that you're reading, a support group, cooking, it can be anything that's helping you creatively to release some of the tensions. And some that we have out there is, other outlets can be just writing a letter to the person that you've lost, telling stories about them, making memory boxes, and then just some red flags on when to look out, things to look out for, both for yourself and others, to kind of take it to the next step and maybe get some professional help. Is obviously anytime there's any thoughts or concerns of self-harm thoughts or homicidal thoughts, highly recommend reaching out for professional help. Also, if high-risk behaviors are continuing, whether it's speeding, gambling, drug use, alcohol, really focusing in on getting some professional help when it comes to that. If you notice that you're unable to complete tasks at work and it's getting worse, if you're feeling like that spiral, so to speak, those are times to reach out. And then just to kind of touch base, because we all know alcohol usage is quite a concern in the South Asian community. So, to make yourself a little bit more available, informed on harm reduction and abstinence model. Abstinence model is where we just don't touch it at all on the measure of failures. 3 months sober, not anymore because I've relapsed, so now I'm 1 day sober. Whereas harm reduction is more just on decreasing the risk behavior. So maybe I'm only going to drink on weekends and I'm not going to drink on weekdays, or I'm not going to drink when I'm grieving, little things like that. That is something that a professional will work on you individually with, on what's going to be the best option for you. But just, I wanted to make sure we talked a little bit about that. And then just real fast on kids as well, to be mindful that kids are going to grieve different as well, particularly those that are like under 12, especially 6 and younger. Be mindful of some regressive behavior. What that means is, as they identify more that, so the younger they are, they're not going to necessarily know the constants of death, right? They might just notice that someone's not around, so they might start asking like, when's Dada coming back? Even though you've told them that they've passed away. So some regressive behaviors to look out for is like thumb sucking, maybe bedwetting, maybe increased irritability or crying. These should fade with time as well as the new norm comes up. But if it's something that's sticking around, make sure you get some support for your child as well. And then I want to share, and I'm cracking up at the timeline because we were supposed to be done in 20 minutes and we were not. So supporting others who are grieving. This ring of grief, I have shared it with so many people, and it has really helped me when I'm trying to offer support to people in my life that I care about who have lost someone, even though it may be a loss for me, like it's a bigger impact for them. So the image that you have on your screen right now with the ring of grief, the absolute center of it is the individual that has passed, or the incident that the loss is, whether it's a health diagnosis, whether it's someone passing away, etc. And then as the rings go out, you will notice that the significant other, the parent, the child, the sibling, those are all in the inner circle. They are the ones immediately affected by this loss, right? The highest capacity of being affected by this loss. And then each ripple out is another layer. So maybe it's like close friends that were almost like family, they're experiencing loss as well. And then, friends of friends, colleagues, etc. And then Samaj itself, right? So we as a Samaj come out all the way in the end. The biggest message from this is we always offer comfort to people that are in the inner circles of this loss. So whoever is ahead of us, so to speak, in this diagram, we offer them support, we comfort them, we share space with them, we let them kind of direct how we're going to do things. And then we vent our distress, our stressors, we vent out, because we don't want to further burden the people that are at the center of this grief. We don't want to further burden them with our stuff, right? I'm not saying I don't want you to share your stories and share that this loss is affecting you as well, but let's not add barriers to them, right? So we want to share the rituals, we want to share the space with them. But that came up a few times today, and I wanted to kind of acknowledge that I know different, especially with generations, like people are having a harder and harder time. It's like, I don't want to sit here and say all these words of, something that I believe or don't believe in, or I don't even understand them because I don't speak the language. The way I've tend to handle it is it helping? Is it honoring the person that we lost? And if it is, then I'm going to do it. And if I don't know that answer, is it helping the people that are in the inner circle? And if it is, then I'm going to do it. Right? So kind of really giving them the control because they're already in this uncontrollable situation. We also can assist individuals by giving genuine support and genuine statements. So not being vague, like Sajan said earlier, like, oh, well, life's going to have to go on. No, it's not that easy. And that's kind of invalidating people's grief as well, right? Or it could have been worse. I think that's one of the worst things that people can say. Instead, like really focusing on, man, I'm really sorry for your loss, or this loss is impacting me in these ways, or I really miss her when I think of this, right? So kind of being really vulnerable with our own emotions and present with them can be helpful. It can also help to help the individuals that are in the inner circle create new memories or find new ways of offering support to them, right? We talked about the memory box, or what if we do this on the anniversary, or what if we do this, there's a birthday coming up, what do you want to do? How do you want to share? How do you want to spend your time on that day? And we're giving some specific ways that you can be present for them. And then always the rule, right? We don't ever put anything on the table that we're not going to be able to follow through on. I skipped over the first part, but obviously the practical support, if you're able to help on the finances and deciphering it, do it. If you're able to help on the legal side because you understand it, do it. If you're able to help on the medical side, do it. I'm a therapist. I tend to help people in my circle by offering resources and things like that. So those practical things that you can do, please do if your profession and your knowledge allows you, but then kind of be mindful of the other ways we can offer emotional support to people as well. And then again, a special note for the kids, being mindful that they're going to need different things as well. structure is one of the best ways we can help children because they are a pattern of routine. So if we take the routine out, now they're reading a whole nother thing. So trying to keep things as normal as possible for them, allowing them to continue to have their outlets, their social outlets, so that they realize that. And same goes for yourself, allowing yourself to have those. Yeah. And oh, sorry, one last thing on that slide. If you're offering support and we talk about those red flags, that comes up, be mindful that if you are telling someone to reach out for professional help, there most likely, especially in our so much, there most likely is going to be some resistance. So be mindful of that, be prepared for that, stay consistent, be specific. Don't just be like, hey, I think you need to go talk to someone, or I think you need to call this helpline. Instead, be specific, hey, last night you made this statement, and quote them. And I think that because of that, this is the next step we need to do. So don't fold because there's some resistance there. It's going to be expected, and then get reinforcement, get other people that can help pass on the message as well. And with that, I'll pass it on to Sagar.
Yes, thanks, Hema. Some very, very terrific tactical techniques. What we want to wrap up with is things to avoid. I think nobody knows how to do grief. Nobody knows how to do loss perfectly, just FYI. But there are some things that you can avoid. And number one is avoid minimizing the loss. I think all three of us have touched on this, but avoiding things like saying it could be worse, life goes on. Especially in the South Asian community, for our older generations, going to a younger person experiencing loss and saying like, Bhagwan or Bhagwan nahatmache, or just those little things that we say that can sometimes when we don't know what to say, it's better to sit in silence with those who are grieving than to try to fill the space with things just to say. Second is avoid adding more decision making by being vague. I think when people are experiencing loss, we'll send them a text or we'll give them a call or we'll visit them and we'll say, hey, I'm thinking of you, let me know what I can do to help. Well, they're in the center of the grief. And so by asking them to think about what they need from you is adding a barrier to their grief process. So it's very important that you're specific. Hey, I know you've got a lot going on. You've got family in town. Would you like me to bring dinner by on Tuesday? Or, hey, I know that it's been a couple of weeks. Are you able to grab coffee on Tuesday at 2 p.m.? Specifics are important when we are supporting others because we don't want them to feel like they have to make more decisions. So please avoid being vague in whatever way. I think in the South Asian community as well, people just show up. We also don't encourage that, especially like after someone passes away or we lose someone, people just come over unannounced. And by the way, that's not always helpful. So it's really important that you ask the people who are grieving if they would like visitors or if they would like to have you over. And if that's the case, ask them present them with an option rather than say, let me know when is a good time, right? So again, our key takeaway here is please be specific. And Hema mentioned it earlier as well, is if it's an anniversary, rather than saying, hey, how are you feeling about the anniversary coming up? Offer them with processes that you can actually execute and carry on. And I think it goes without saying, please do not offer support to those who are grieving without being able to execute and carry it forward. Avoid judging or comparing grief to yours or others. So especially for men in the South Asian community, I have seen this personally. At the funeral home, they do not cry. When they go home, it's a completely different experience. And like Hema mentioned earlier, we as a community withhold our grief, or that may be the case, but then when we're back home, that's when we're really alone with our experiences. And we know the research shows that South Asian men have a much higher alcohol abuse rate than non-South Asian men. And these are reasons why we need to have support pathways. There is an Alcoholics Anonymous group specifically for South Asians, which we will be sharing with you. It's all done virtually on Zoom, so you don't have to even go anywhere, but there are resources available. And that's my little tangent there. But back to what I was sharing is avoid judging or comparing your grief to others. No matter what grief you have experienced in your life, it's valid, it's real, and it's been difficult for you. But please do not ever share with somebody else who is grieving that it took you X number of weeks to start feeling X number of ways. This can give false hope to people. It can also facilitate further negative emotions, because if they reach that point and they're not where you were at, it can actually cause more complications. So again, it might sound very, very superficial, but the things we say to people who are grieving matter. We might think that they're in this emotional cloud and they're forgetting everything, but at 3 in the morning, they will remember exactly what you said to them. So please be cautious, and please sit in silence and be there in solidarity and support, and not say things just for the sake of saying things. I have been through multiple griefs, losses in my life, and I'll be really honest, sometimes I appreciate it. I really do. I love the support, but sometimes people will just say things to me and I'm just so confused by it. And I know that they have the best intent in their heart, and I know they want, they want to be there to support me, but it does make a difference. For adults, please avoid labeling emotions for them. Not going to somebody who has lost someone and saying things like, oh, you must be so angry, or, you must be so frustrated, or especially with sudden or unpredictable loss, saying things like, well, at least he, she, or they were not in pain. Well, first of all, we don't know that. And second of all, we're not in any state, even as providers, clinicians, mental health experts, resources, to assign emotions for other people. So please, we ask that when you are supporting others, avoid labeling their emotions by telling them what they should, might, could, would feel, and rather allow them to feel what they are feeling. Lastly, avoid passing judgment or guilt, regardless of the situation, regardless of how the loss occurred. I think we've talked a lot about death recently, but if it's a divorce or if it's a breakup, regardless of the circumstances of why the loss has taken place. I have worked with individuals in the past who go through divorces for various reasons, and they still grieve the loss, even if they feel or do not feel they are at fault. Our role in supporting others is not to assign blame or fault or guilt or judgment. It is to be there for those who we care about, regardless of the situation. So please know, especially in the South Asian community, that there are various constructs and there are various stigmas that exist, but it's important. I think it's very, very common. One of the other things I hear is, so and so got a divorce because the other one was drinking too much. Well, that may very well be true, but we are in no position to say that, and we are also in no position to know why that other person was drinking. And of all the things, we're minimizing the grief that the other person is experiencing. So please, my soapbox is to support others with empathy and with true concern for what they're experiencing. And especially in the South Asian community, we have all of these prescribed ways of why things happen. And it's time that we let go of those and embrace what it is that people are experiencing differently. We do want to wrap up. It's so ironic. I love that Hema brought this up. I have to share, as we were planning this panel, we said we were going to spend 20 minutes going over the information and 40 minutes going over our questions. But I think the information today has just been, we're all so passionate about it, as you can tell, that we took triple the amount of time to get through it. But please be present and comfortable with your vulnerability. However you grieve is however you grieve, regardless of however other people think. And so we hope that what we've shared today has been helpful. We still will move on into the question and answer portion. For those of you who are able to stay with us, we would appreciate it. We welcome your questions in the chat box. We welcome you to raise your hand. We are here to support you and help answer your questions. This last slide is resources. If anything we have talked about with you today has been a trigger for you, please take a photo, please screenshot, please know that there are resources available for you here with the National Suicide Prevention Hotline, a warm line, a text line, as well as a local resource. So on behalf of the panel, on behalf of the entire South Asian and Bhakta Samaj community, we're really thankful for everybody who has joined us, who has come to learn today. And with that, I will turn it back over to the organizers to help facilitate our panel question and answer session.
Perfect. First of all, I want to say thank you. All of that information was amazing. And I think a lot of people resonated because we did get questions. So I'm going to go ahead and ask those questions and then we can answer as we go on. So one of them that we got first off that we can start off with is, can you put more light on what the topic, Sajan, about what you were talking about right now? Respecting by giving them their personal time for cooing instead of calling them right away after they've lost someone. One, instead of especially visiting them right away, but this person asked, but I feel doing this constantly, reminding them of your loss, like please give some tips on how to take it instead of calling them or visiting them and constantly showing up like you had mentioned. And someone said, I feel like this is a really important concept for a community to learn.
Shayna, thanks for sharing that question. To help me make sure I've understood the question correctly, the question is, how can we support those who are grieving in other ways without showing up to their home unannounced? Is that correct?
Yes, and then how to have that conversation with them that we want to grieve and we need some time before we have visitors.
Yeah. That's a great question. I'll get us started and then I welcome Hema and Sag to add in. I think this goes back to that grief circle or the support circle, which was on one of our slides, is, from the inward outward, it actually starts as a community. And I think that the entire Samaj has to understand that times are changing and we don't need 700 people at funerals because the grieving do not need to be worried about finding hotel rooms and cooking and meals. We are actually in a way being disrespectful when we do that. And so rather it's important to allow the family to give us the direction which they want to go. However, we also understand that in the South Asian and Bhakta communities, there is a strong sense of amazing community, which is very important. So how do we balance that with helping is simply by asking. Asking the family first is the most important step, is saying, would you like our help? And if so, what are your desires for what is taking place is important. If at that point they share with you, then like Hema mentioned, executing is important. So many times we and the Bhakta Samaj and South Asian community care so much that we just start doing things. We just go and we just start inviting people and we just do it. But it's not always healthy. And so we need to stop, we need to pause, and we need to ask the family, Tamare શું કરવું છે? તમારે કેવું funeral જોતું છે? And we need to make that extra initiative as a community and allow them to be in the driver's seat. So Hema, Sag, what would you add there?
Okay, I'll start. Excellent point, Sajan. I agree. I think we also need to keep in mind on the generational needs, right? So the older generation might be more comforted with people showing up because they also don't have the vocabulary to say, no, I need space, right? Or that might be how they're grieving, is by sharing space. Whereas I feel like my generation and the younger generation is a lot more aware of what's helping, what's not helping. So to ask being the primary point as well, is to make sure you ask. And then when it comes to reaching out, I mean, we're all human, right? I will not lie, there have been losses where I have had my phone with the person who I'm gonna call because they just lost someone. And I've just been holding my phone. So I'm like, I have no idea what I'm gonna say. I have no idea what I'm gonna say. And having been a therapist for 20 years, what I can tell you is the fact of what you say isn't probably gonna matter as much of the fact that you called or you text, right? Letting the person that is directly impacted by this loss know that you're thinking of them, that you care, and that this loss means something, I think is very valid, and we shouldn't shy away from that. So when we're saying like, hey, don't just show up, don't do a 700 funerals and now we have to worry about cooking for all these people and all that. Yeah, that's one thing, but then do show up emotionally, right? Whether that's a text, whether that's a phone call. And you know, what I tend to do when I leave messages for people is, hey, you don't need to worry about calling me back. I'm just calling to let you know I was thinking about you. Or I'll send that in my text as well. Because again, I don't want to burden them with like, oh man, I forgot to call him about that, right? So being mindful of that.
I think to add to all of this is redefining what presence actually means. So presence doesn't mean that I need to be with someone at that exact time to comfort them. Comfort means I can do other things. So for example, you know, I think, and I preach to everyone, communication is something I think South Asians don't do very well at, because we don't know how to do it, especially if someone is elder to us or someone is younger than us. So I think number one is, how can I communicate presence? So do I need to be there, or can I do other things to help them out where I don't become a burden to the family who's grieving? I think there was one question about what I wanted to specifically address is, especially with our older age who are coping, and like they cope much differently. And as Hema has said, you know, they might not know how to express it, and they might need individuals there. One thing I've noticed is when our elders lose their spouses, or just we lose our elders, we often go towards the beginning part of everything and we're present everywhere, and then there's a cutoff. And then we go, oh, we did what we needed to do as a family, so our karma is good, so we can move on with our life. Well, you know, that can be really disrespectful for the family who's grieving, but also you're kind of cutting the string at that point and saying, okay, we did our presence activity. And I think one of the most important things we need to follow up on is, how can we continue the presence, especially for our elders who are grieving, because they might need to be there. We might need to be there to continue rituals, you know, feed them. We might need to be there to help them understand and cope with them, help to share experiences. One of the biggest things, so my primary role is research, and one of the biggest things I've seen in the literature is that when men pass away, there's a 17% kind of likelihood of their spouse, of a female spouse passing away, versus when females pass away, there's a much higher likelihood of a man passing away right after, right? And when we cut the strings and say we've already done that presence activity, we're cutting the mental health that's moving forward with these individuals who are grieving.
Yeah, thank you so much for these answers. I think it's such an important topic that a lot of people definitely have the question about, but they're scared to ask it. So thank you for that question, of course. And then we have another question from the chat. And this person said, I feel that our community does not let people grieve the way they need to. Some of my family members were very insensitive when I lost someone. The actions and words lacked empathy. They acted like it was a fun family reunion instead of a funeral. It's like our community completely ignores the person who's past feelings and their pains and their grief. I'm angry and hurt by this behavior. Is it okay to distance yourself from or stop interacting with family members like that?
Man, whoever submitted that, thank you so much. And I feel for you, and I feel that you're having to experience all these external barriers while you're already navigating through grief. And I think this is something that other people in our community do tend to struggle with as well, right? Because we're already going down our own path with grief, and now there's these external expectations, or maybe what's coming across as, you know, disrespect or whatnot. But to answer the tail end of the question, I'm never going to side with, hey, we just need to break people off, unless it's like becoming toxic and unhealthy for you, then that's a whole nother conversation. But at times like this, I feel like this is where we need to be our best advocates and be like, you know, this is what helps you, and that's great, but this is what's going to help me. This is what I need right now, right? We got to start asserting ourselves, because we do know, we are our best experts. So we know what's going to help us. And if, sitting in Pratna is going to help one person, that's great. Don't force me to sit here with you because that's not helping me. I need to take care of myself as well. So to be more mindful of that and instead utilize, whether it's through professional help or through leaning on friends that are supporting you on ways to articulate and advocate for yourself and also communicate your needs with your family members, and use it as an opportunity to kind of teach. A couple of different things that also came out is you mentioned anger, and I just read this line the other day and it really resonated with me, and I shared it with some of my friends who've experienced loss. And it was, and I'm going to butcher it, but it was something like, I sat with anger long enough until she revealed to me her real name was grief, right? And the reason I share that is because I think it's important for us to remember that a lot of this impulsiveness that we might be feeling after a loss, and again, whether it's someone passing away or a loss of a relationship, a health condition, etc., a lot of that impulsiveness, a lot of that anger, it's still grief at the end of it. So give yourself some time to process what's going on before you make any impulsive decisions.
And I think that is an absolute perfect capture. I will add, I do think the research does show that isolation after a loss is generally produces negative outcomes. So again, I do empathize with the individual who submitted this question. I do agree with Hema that it can be difficult not only to process what you're grieving, but now the guilt that you might be feeling as a result of not identifying with this becoming a family reunion. So I do not encourage isolation, but I do encourage protecting your peace and knowing that you, like Hema said, being your advocate, not feeling guilty about it. I think the other thing we hear often, especially in the South Asian community, is, man, I feel guilty for not going to every time everybody gets together, or I feel guilty if I choose not to. The truth is you should not feel guilty. And of course, it's difficult, but easier said than done, because your well-being matters. You are also, experiences are valid. So it's possible to balance what's important to you. And, like Hema mentioned earlier, especially for someone like me who I don't know the words of an arti, and I don't know what pratna means, and I don't know any of what that means. But for me, when my grandmother passed away earlier this year, I was able to join all of the Zoom pratnas, not because that's how I wanted to grieve, but because it was honoring her. And I knew that it supported my family who were closer in the grief circle. And so while I didn't completely disconnect and just say, this isn't what I want to do and not do it, it's important that you balance it. And I think that for me, there would have been other emotions that I needed to process. So, it's all about balance. It's all about doing what's right for you. And also being able to communicate that with your family and let them know, I do feel that, whatever activity is working to help you process. It's not what is helping me. And so I will prefer to do X, Y, and Z. So absolutely great question.
Again, I just want to kind of mimic what everybody else is saying, but I also want to, when I heard this question, my prevention kind of brain went off and said, how can we prevent this so that somebody else in the future doesn't feel like this? And what can we do as we sit in this room listening to this question to make sure our sons and daughters, our aunts and uncles, our bas and dadas don't feel that type of like judgment or expectations where they feel like they need to cut themselves off with their family members because it's just too overwhelming. So I think the moral of the story is, at the end of the day, we all love each other. And I think with love, sometimes we make mistakes. And I think our greatest prevention is, if I love someone, what would I think would be the best resource or the best thing for them right now, who are going through grief? And this is not just grief through dying. This is grief through a divorce. This is a grief through someone not getting married or not wanting to get married, to have a baby, or just the general stigmas we have in our community, right? So I would say, let's prevent this from happening in the future for somebody else.
And to second on that, Sagar, I think the answer is leading with empathy, right? Like, let's lead with empathy. Let's show grace. Even in the worst experiences of our lives, we're learning, right? So maybe we're learning what not to do. And I hope that by sharing this and putting this question out into the samaj, that you're helping other individuals know what not to do when it comes in their family. So thanks for sharing.
Yeah, thank you so much. And just going off of one of the comments in the chat, this information will be relayed. We will be relaying all this information, and it will be spread on all platforms, even WhatsApp. So we will be relaying this information. So for another question, I think we should probably use this one to round it up, or if we want to keep going. But this one, I feel like a lot of people have experienced in the past year, especially with the COVID wave in India. So if you weren't able to be with your loved one when they passed away and not being able to say goodbye, how do you cope and deal with that? Because I know it's definitely something that's hit a lot of people in my family personally as well. So how would we cope with that?
I think just in recent times with COVID and social distancing and inability to travel abroad, we've had to find different ways or more technological ways of coping with just day to day, but also coping with things that are going on. And I think to answer your question, I would say, well, what helps you cope, right? I can't tell you what makes you feel better. If you tell me, I can, and I'll be able to provide you resources. And I think it if you're able to create a Zoom link and being able to see loved ones, or creating a social media campaign, or sharing things via Google Images or whatnot. And I think it's a tough question because, of course, we would like to be in the presence of our loved ones when grief and loss are happening. I think what we should be doing is gathering the things we do have and what we can build in supporting individuals. Yeah.
Thanks for that. Yeah, and just to kind of segue right into that is really focusing on our controllables, right? I think COVID kind of brought up to light, and more of us have experienced this now of not being able to be present. But this is something that I've done with my CISM training with different corporations, especially with COVID in India and having people here that couldn't go back, et cetera. Finding the controllables in the situation. Yes, technology is there. There's, I've attended Zoom funerals. I'm pretty sure most people that are on this today have done the same. Can't say it's my favorite, but you know what? It was still comforting. It was still better than not attending anything at all. So there is that level of doing that, but also kind of going back to some of the slides we talked about is just finding a new ritual, finding a new way of being there. I've attended services where people have called in to give a speech, right? And okay, we're going to use technology that way, or we can't physically go there, but what are some other rituals we can do, or something we can plan at a later time, whether it's with the ashes or just a new memory, right? A different way of memorializing this person. How can we do that so that we're still collectively grieving? And I think that part's important to remember, that a lot of things are outside of our control. And if we learned anything coming out of this pandemic, is that a lot of it is fragile and we don't have control of it. So finding different ways of memorializing, finding different ways of sharing the story as well. I like sharing my little things that I read. So one of them that I read that I share also a lot in my therapy sessions is that each of us are going to experience death in 3 forms. The first is when our heart stops and we die. The second is when our body is cremated or we're buried into this earth. And the third death, and the most painful death, is the last time our name is uttered into this world. So as individuals that are the survivors of people that have deceased, we don't have control of the first 2, right? But we do have control of the last. So we can make sure we share these stories. We can make sure we find ways to memorialize these individuals that matter to us so that the stories aren't lost, whether it is a social media campaign, whether it's a scholarship, whether it's a park, something as a way to make sure, or just family gatherings, right? Where every Christmas we're going to do this, or every Diwali we're going to do that. but finding a way, Ma's birthday, we're going to make her favorite meal just as a way to celebrate her. Finding different ways of making sure that their name is not uttered the last time.
Emma and Saga, I think those are some very, very important comments. And just one thing I would add to that is for those who may be grieving a loss without being physically present, I just think that the art of expressive journaling can be very, very helpful. Please, if you are grieving or experiencing these emotions and you are unable to be with your loved one, one very, very helpful thing that might work for you is to be able to get a journal. And this can be a private journal. You do not have to share it with anybody. You can throw it in the garbage every night. You can set it on fire, whatever you want to do with this journal. But in that journal, each evening or each morning, start your day by writing maybe a letter to who you lost, or something that you appreciated about the person who you lost, or something you wish you would have had time to tell the person before you lost them. What this does is it's going to help you find that closure which you may have not gotten by being with your loved one in whichever setting they were at. There is a plethora of evidence-based research out there that shows that expressive journaling does produce positive outcomes for individuals. And so, these are not, when I'm saying journaling, and if you prefer to write in Gujarati, if you prefer to write in English, Hindi, whatever your preference is, this isn't like, what did I eat for breakfast today and what did I have for lunch today? This is true freestyle journaling, which allows you to transfer what you might be experiencing emotionally into some form that's memorializing it and honoring the person who you lost because you weren't able to be there with them physically. So I definitely advocate and encourage for journaling as a good way to help with that. And as Hema mentioned, I think just carrying the name forward and carrying that those memories and legacies can be very helpful.
Yes, absolutely. Thank you so much for that. We did have another question of how does one talk to kids about death and grief? I know we touched on this, but just maybe a little more in depth.
I'm going to start with that, and then you guys can add on as needed. Just to start, I know you shared the document where we have we have a few resources on this slide, but we have even more on a different document that'll be made available to all of you. And I have an article on there that talks about different ways of approaching it to kids. But at the end of the day, the age of your child is going to matter. The maturity of your child is going to matter. You know your kid best, so you know what's going to be needed. But from a therapeutic standpoint, don't be vague about it. I think one of the worst things, and I don't know if we do it too much in the South Asian culture, but oh, dada to hui gya, or like in English, they'll always be like, oh, they're resting now, or they're asleep. Don't use words like that with kids, because chances are you're gonna have a child that's gonna not want to go to bed at night because they're scared of dying themselves, or they're gonna be really paranoid about you going to sleep because they don't want to lose their parent too, right? So kind of be mindful of the language that you use absolutes. Like I mentioned earlier today, kids that are younger than 2, they don't even understand death, right? But the kids that are younger than 6, the constant of death, like that object permanence hasn't happened yet. So they're not going to realize that because so-and-so passed away, that it's forever. So it's common for them to come back and ask about those individuals. But yeah, make sure it's age appropriate. Use those firm words so that they understand that this person died. They don't need to know how, they don't need to know all the details. Obviously, if these children are now tweens or teens, you can be a little bit more vulnerable with them, share a little bit more. 12-year-olds, 6 and up, they start understanding that death is permanent. So they're probably going to have questions. Actually encourage you guys to talk about your emotions with them to help them identify emotions, because they may not know certain feelings. They may just know they're feeling angry, but they don't understand where it's coming from, or they're sad, but they don't know why. So educating them that, do you think maybe you're a little upset today because things are kind of different because so-and-so is not here and normally so-and-so would be here, I'm having a hard time with it too, or I'm really thinking about Ma with this, or I'm really thinking about your uncle with that, so that they're a little bit more aware. And obviously where that child lies within those circles that we talked about earlier will highly differentiate how you share with them too. But more than anything, let them know that what's going on, and also give them choices when you can. I saw this recently where, a child was kind of forced to be there during the services and forced to be there to take part in certain rituals. And it's just let them choose, because you don't want them to get nightmares off of it either, you know, like give them a little bit of grace, a little bit of space, because again, this is a very uncontrollable situation. And when we allow them some space of, do you want to go up to the coffin? Do you not? Do you want to go to the cremation? Do you not? When we give children that choice, it's really helping them kind of regain control of the situation. You guys want to add?
No, I think that nails it. You are so amazing, Hema. I think that is perfect. And you want to reiterate, don't lie to kids. I think that's important. And you think you might be protecting the young ones. You might think you're doing what's best for them, so that way they don't experience the grieving and loss that you might feel that you could impose on them. But they have a right to know. As Hema said, you know your kids the best. So I think I echo everything she said, and I think it's important to say, not use those abstract words of, whatever, especially if you've lost a grandparent, if they've lost a grandparent, and then the other one, saying, dadato mahategia, or ma vedadanta punchigya, or, those kinds of things. Like, just tell your kid what has happened, because, like Hema said, it sets the child up for not being in a healthy state of mind. If especially with kids not wanting to go to sleep in their own bed after a loss, is huge, because if the parents have not set expectation of what properly took place, they've now developed a fear that that's going to happen to them. And so we oftentimes hear, after we lost my so-and-so, my child just hasn't been wanting to sleep in their room. Well, if you've just set them up to believe that sleeping in their own room means that they're going to lose you, well, of course not. They're not going to want to sleep in their own room. So that's important. I believe I received a private message chat question. It's quite lengthy. I'm going to read it. It says, you mentioned life does not go on, but in our Bhakta community in general, our elders taught us that life goes on after a loss of a family member, by doing very few rituals after death. After the cremation, our recovery process starts soon. Yes, social gatherings and praying together for a few weeks gives great support to all affected family members. Do you think what our elders did and followed minimal rituals helped us in the grieving process? Ram Kabir. Well, Ram Kabir, back to you. Thank you for the question. I think it's important to understand that what our elders did to grieve the loss before us is what they knew and felt was right. And so it doesn't necessarily make it right, wrong, or the other, but I can't speak to whether or not it helps them, because I haven't had the chance to get to know them. But I think this just really goes back to what Sagar, Hema, and I have all shared today, is that rituals might work for one person and they don't work for another, and give people the choice to be a part of it, which I think is really, really important. So while it can support the closest to the family, knowing that, 50 years ago, even actually, to be very honest with you, I've had, I've attended some funerals in India, and it's very different than in the United States with just how rapidly everything occurs. And so it's fast forwarded, right? Like an individual passes and the next day their body is cremated, the family has not had the chance to even arrive from the United States to say their final farewell. Whatever, for so be it reason, that is how it works in India. And so I think that's what Shana, one of the questions Shana shared with us from the audience about not being there. But I think that knowing what rituals are right for you and you today, because the other part of that is what might have worked to help us 5 years ago might not work anymore for us as the same person. So we change, we grow, and the experiences we have can impact how we organically experience grief. So Hema, Sagar, anything you would add to the ritual side?
Not so much on the ritual, but that comment, Sajjan, I know was on the first slide, like, the whole life moves on. You're like, no, it doesn't. I don't want people in the audience to misinterpret that to mean that, no, we're going to be stuck here forever, right? It just means, I know I had a friend tell me once after a loss that, it's just not going to be the same. And I'm like, yeah, it's not supposed to, and it's not supposed to be the same, because then that means that person didn't matter. That means their impact didn't matter. Like, no, it's not supposed to be the same, but that doesn't mean we're going to be sitting where we're sitting right now either. Like, life is going to move on slowly, and we're going to find ways to work around this pain and grow from it. But for it to be that callous, oh, life goes on, you got to move on. That's, I think, the term that Sajin was talking about when he said, like, no, life doesn't go on. Like, that's not something comforting to tell someone while they're grieving. And totally, I'm going to digress here, and maybe you two gentlemen can do some research on this. But prior to doing today's panel, I reached out to. There's been tons of loss in my family and my friend circle, and I reached out to a lot of them to just kind of ask, like, what are your thoughts on this? Because I have mine, right? But who am I in the grand scheme of things? And I found it really interesting that a lot of the men, not all, but a lot of the men that responded to me said that the rituals helped them because they didn't have to worry about what needs to be done, when it needs to be done. It was like a little playlist of, like, all right, this is my little hand guide of what I need to do. But a lot of the females, not all, a lot of the females were annoyed because they're like, I was so busy cooking, I was so busy cleaning, I was so busy accommodating that I didn't get a chance to grieve, and I'm pissed that I didn't get to do this, and I'm pissed that I didn't get to do that. So I found it really interesting. Again, this isn't like scientifically studied, but just in my little poll that I did, that I definitely noticed that gender gap, where the men kind of, again, saw it more task oriented, like, cool, we went through all the stages, whereas a lot of the females that reached out felt that it was more of a process and they weren't able to start it when they wanted. And I feel like we will go through that, particularly in my generation and the generation right below mine, because we are right in that in between, where we're not fully Western, right? Where we can just do what we want to do. We still have the obligations and the needs of the generation prior to us. So kind of finding that balance there. And with grief, of course, if you haven't heard it loud and clear today, is everyone grieves different. And as long as it's not hurting you, and as long as it's not hurting another person, I'm all for it. Do what helps you, as long as it's not hurting you, as long as it's not hurting another person.
I think we have our research project coming out of this session, Hema. So we are definitely excited. And before I turn it back over to Shayna for a final question to wrap us up, that does go out. I know we have a lot of people who have joined today and that this is being live streamed on Facebook. If you do have an interest in conducting research on South Asian mental health, please do reach out to us. We all facilitate various research projects, and we'd be happy to have you join us in our work. So with that, I will give it right back over to Shayna.
Thank you so much. And we appreciate the time that you took today. So we'll ask one final question. And that question will be pertaining to the elderly. With elderly passing away, how can people help their partner cope?
So I think one of the biggest things we need to talk about when elderly individuals are passing away is we want to talk about the hierarchy structure within the South Asian community. So in particular, one of the things we need to be very mindful of is where are we shifting the dynamics in the hierarchy within our partners or whatnot, and where are they moving in that dynamic? And I think, again, what we need to really be mindful of is communication. What do you need from me? How can I help you? Do you need me to do this? Or if you see an ability of being able to take care of the bills or take care of, ceremonial aspects or even religious aspects, to be able to just say, you know what, I'll take care of this while you're dealing with other things. So I think the biggest thing, and one of the things I'm going to echo, is just appropriate communication and just being empathetic.
Absolutely.
I agree. And one thing I will just add to that is communicating in their preferred language, I think is very important, especially for us who might have grown up here in the Western world, and there may be a language barrier with our grandparents or with the elderly. Make sure that we're leveraging supports where they have an opportunity to share what they're experiencing in Gujarati or in whatever language they are most comfortable in, rather than asking them questions in English, because then they're going to to be limited in their response. But also, as Hema and Sag have both mentioned, just keeping an eye on their behavior. Are they eating less, or do they have a sudden desire to be less social than they may have been pre-loss, or what are those things that we need to be on the lookout for, but also providing them, I think, with a pathway that's comfortable for them. If they want to share, I will tell from my personal experience with the loss of my grandma, I've just been having so many conversations with my grandfather about his life and her life, and he's been telling me just everything. And it's been so amazing to learn about just how they grew up, and what things were like. And I've noticed him light up when he has the opportunity to share those memories. But again, that does not work for everybody. So I'm not sharing that example as the right way, but find what works for you to connect with those who are experiencing a loss, and then amplify it, and know that one day you can be in denial, and the next day you can be at anger, but it's at your own pace. So super question to wrap us up.
Yes, thank you so much. And thank you to the three of you for taking the time to speak to us today. I know you're extremely busy, and touching on this important topic, I definitely feel like a broken record when I say this, but uncomfortable conversations create change. And I think that's the biggest push of the Bhakta mental health group in general. And we do want to say that we have resources, we have all the links, and we will be dropping those in the chat right now. And we also have an Instagram where we have a link tree. We will be sharing resources pertaining to grief and loss on our Instagram as well, through our link tree, through the comment section, and on Facebook as well. We will also send out forms and documents of recommendations on grief and loss that we've created, and we'll also send those through WhatsApp as well. And please feel free to share with anyone and everyone. We want to reach as many people as we can, and we hope to continue to do sessions like these on important topics. Ram Kabir.
Thank you all for joining. You want me to end the session, right?